Maggie Bebler. I work for Health Partners, and I primarily work with one neurosurgeon. And we see patients at different hospitals at Methodist, Abbott, and University of Minnesota, and Regis Hospital. So I go wherever he goes to help him. That's primarily where I spend my time. So I work for Health Partners, and at Regis Hospital, we're a level 1 trauma center. And with neurosurgery, we work with brain and spine. So my day could consist of 2 days a week I spend in the clinic, where we could see anywhere from 15 to 25 patients. Every morning I see patients in the hospital, I round on them and see how they're doing, and whether it be they need more orders or need to go home, I work with that. I also help in the operating room for certain cases. Every day is a little bit different because of being a level 1 trauma. We take a consult pager, so if something comes into the emergency room, we go down there and see that. So I'd say the excitement of my job is that every day is completely different. It's exciting, it's challenging. I think it's very rewarding as a nurse. I love it. It's very busy. So I'm actually a biology major for my undergrad, and then I went to do a year internship in nuclear medicine, which wasn't for me. It was more of a, it was exciting. I learned a lot, but it was more of a, you didn't do a whole lot. You didn't have a lot of interaction with patients. So after that, I went to work for a medical supply company that provided low air loss mattresses and wheelchair cushions for patients with bed sores. And when I was working there, I did a lot of work with physicians and nurses over the phone, and it was at that time I decided I want to be a nurse. So I went back to school at Rush University in Chicago and got another bachelor's in nursing. And then I worked at Northwestern Hospital downtown for a couple of years, and then went out to Johns Hopkins to work for a year. And then I decided I wanted to come back to Minneapolis, where my family was, and felt like it would be a better career move for me, I guess. And then I went back to school to get my master's in nursing at the University of Minnesota. So I finished that, so I had my master's as an advanced practice nurse, as a clinical nurse specialist. So with that, I can prescribe and I can bill. I'm a provider, so I can see patients independently, but I also collaborate with the physician I work with. I guess I just, at the time, to be totally honest, it was so different for you guys today than it was for us, but you know, my parents just encouraged me to go to college. I really went to college. I didn't really know what I wanted to do. I thought I was going to college maybe for nursing, but when I got there, I realized I didn't have a nursing program. But I stuck it out and just pursued biology. I always loved math and science. You know, I always wanted to do something in healthcare. I thought of becoming a physician, but I guess I never went down that road. I think that's kind of what influenced me to be a nurse. It was one, you know, working in the healthcare field, but not as much schooling, I guess. I guess I would say with nursing, I think, I was actually thinking about this the other day when you asked me to come in. I think with nursing, the one thing is that there is so many opportunities as a nurse. I think people think of a nurse as a bedside nurse. You're actually taking care of patients in the hospital at the bedside. But that's not all there is. I mean, there's opportunities for, you can do triage nursing, you can work for medical supply companies, you can work for pharmaceutical companies, you can work for the NIH, the National Institute of Health. There's just school nurses, there's just so many roads to take if you want to be a nurse. There's just so much opportunity out there. But I think that's the uniqueness of a nurse, is that, you know, there's just, the opportunity is just unlimited. I think sometimes it's exhausting to always, you're taking care of people all day, and then you go home and you take care of people. You know, but I would say I love it. You know, it's rewarding, but I would say it's, you know, sometimes it's tough. But, and you do see a lot of difficult cases, you know, or patients that are extremely sick or that come into the emergency room that will probably never make it out of there. And I think that's really hard to talk to the families and see the patients. And
I was getting that sounds really
yeah,
hard.
we see them in the ER, and that's the case. Yes, and we do talk to the families, and it's heartbreaking, you know, and it's tough, and it's people of all ages, and you know, I think anything can happen at any time, and it's hard. Yeah, I can take you through a day. They're all different, but let's see. So when we take, so last Thursday, for example, we were in the operating room, so I got to work about 6:30. I rounded on the patients we had in the hospital, which was probably about 10 patients. Some are in the intensive care unit. One was actually being transferred out to Bethesda, which is a long-term care facility for patients that are ventilator dependent. So getting him out the door, but it's more of the paperwork side, the discharge for him, and working with the family to explain, setting up follow-up for him. One patient was in the ICU that needed to be transferred to the floor. He was stable. He had had brain surgery. And then the others were kind of a routine, a lot of post-op patients that, needed orders, or I just see them and say, how are you doing today, and encourage them to get up and get moving. And then some of them were just patients that had some sort of a trauma, whether it be a fall that had some spine issues, so they're in a brace, and we're just kind of following them. And then after that, I go back in the operating room and we do cases for deep brain stimulation. We place leads in the brain to help patients with essential tremor and Parkinson's disease to improve their symptoms. And for that, I put the head frame on with the doctor, and we use a propofol to sedate the patient. And we take them down to the scanner, and then we take them back up to the operating room, and then we plan where exactly we're going to place the leads in the brain. And then I kind of leave the operating room at that time and go back and see more patients. And then we're on consult pager that day, so anything that comes into the emergency room, I go see the patient and see how they're doing and assess them. And then I go back up to the operating room and talk to the doctor that I work with, and we look at the images together and we decide a plan, and then go back down and I talk to the family. And it's just kind of crazy busy. And then we do some research, so that's another part of my job is, I got to keep track of all of the patients that are involved in our research study. And then on a Friday, we have clinics, so we round in the hospital, and then we start clinic at 9 to about 4. We see about 20 patients. Some are new patient consults, patients that might be interested in or have like a leg pain that might be interested in or might be not interested but need a back surgery, so they come to us for consultation, and we work them up to determine whether or not they need surgery. And then a lot of them are follow-up patients that have had surgery in the past, or just there for a routine visit, or somebody that's had a fall and that was seen in the emergency room that needs to be seen for follow-up for a head CT. But I'd say every day just varies. It's a busy, crazy job, but I love it.
Cool.
Well, I would say with nursing, especially, you can specialize. So you can work ear, nose, throat. You can work with children. You can work with, internal medicine. You can work with bones, orthopedics. You can work with, there's just this slew of urology, OBGYN. There's just so much opportunity. You can do bedside nursing. And I think for some people that's a great opportunity. I learned a lot working at Northwestern in transplant and trauma and general surgery. That was transplant for liver, kidney, and pancreas. I learned a lot doing that, and then it took me then I went into a float pool nursing where I kind of worked in all different areas, hospice, psychiatry, neuro, and that's when I really found my interest in neuro. But the opportunities would be just, you can be a triage nurse, somebody that answers the phones. In the hospital, you can do what I do. There's other nurse clinicians that are they help kind of support you or support the advanced practice nurses. You can work in a pre-op area, you can work in post-op, you can work in the operating room, you can work, there's just, opportunities endless. There's just so many nursing jobs out there. Labs, you don't like people. I would say go for it. I think it is a job that you'll always have an opportunity. I don't think you'll ever have to worry about not having a job in nursing. And I say if you love people, taking care of people, you will love it. It's it's an active job. I think it's also nice for some people in that, there's different shifts people can do. You can work days, nights, and, PM shifts, which I think for some families that's great. When they have young children to work overnight, and so you can still be with your kids the next day. But I would just say, one thing I think is good, which I wish I had done with my career initially, was, go observe. Ask somebody to work with them and follow them for a day, because I think it gives you a great idea of if it's something you're interested in. I've taken many kids on, not kids, but, adults like you guys. But I think for one who really thought she wanted to be a nurse, she was like, I can't do this. And I think it's a great way to experience whether or not it's something you would like. But I just say, follow your dreams, have fun. There's so much to do out there.